Hello, everybody. My name is Nancy, and I want to welcome you to my first YouTube interview. My channel is designed to help you in awareness of different options that might be available out there for our health. I have a passion of bringing awareness, and so that we can all align ourselves, spirit, soul, and body, so that we can be totally uniformed and having divine health. So I want to have the opportunity of introducing you, my friend Karen, to you. Karen and I have recently met, and she's agreed to be able to share her gift of knowledge and to you all and to our audience, and to serve the world with what the knowledge that she has. So I'm real excited to be able to introduce you, Karen Goodall, my dear friend. She is a certified thermographer and also a certified lymphatic therapist, and she'll briefly go over what that means. So this month being Breast Cancer Awareness Month, I did want to kind of bring an awareness to other options outside of mammograms. As we all know, mammograms is pretty much all that we hear about. And I personally was introduced to thermography about a year ago. And I don't know a whole lot about it, but my friend Karen does. And she's going to share her knowledge with us today. So Karen, first of all, thank you very much. And my first question to you would be, what is a thermogram? If you can enlighten us on that.
Absolutely. Well, thank you, Nancy, for the opportunity. I really appreciate the opportunity to share, because one of my passions as a woman and as a healthcare provider is for people, and certainly ladies, to know that we have a choice. And knowing about thermography and knowing that we have options, from my perspective, is of extreme importance, and certainly a benefit for our long-term health. So I've been a certified thermographer now for approaching 5 years, and learned of this wonderful test really for myself over about 10 years ago. But thermography is a non-invasive, non-toxic way to assess the body by looking at our thermal image, using a camera to assess the body. And nothing goes into the body. We're only picking up what we are naturally sending out, and that being our thermal image that we constantly project.
Well, thank you. And how would that compare to a mammogram? What would be the biggest comparison you could say?
I really, frankly, don't compare that to a mammogram. It's a totally separate test. A mammogram is a test of anatomy. It's looking for a mass or a calcification. A thermogram is a test of physiology. We're looking at the cellular function and metabolism. So they're two totally separate tests, really performing offering two different avenues of evaluation. I look at a thermogram as being a true preventative test. Again, seeing change before, in the instance of our breast tissue, before a mass forms in many circumstances. I like to share with my patients that our breast tissue has to get organized, behaving normally, naturally, healthfully. Is our breast tissue healthy, or is it getting organized to create a mass? Are there inflammatory changes? Are there temperature differentials, really in comparing just the symmetry of the breast tissue? And helping then the thermologist, who is the doctor trained to read the images, to determine, is there something early going on that we can then bring about lifestyle changes, nutrition, lymphatic therapy, any number of modalities, including just simple stress reduction, and looking at the differences in what we put onto our body and into our body, to help reverse this attempt to be unhealthy, before an actual mass or even a diagnosis could even be formed or found.
So would it be safe to say then, Karen, that the thermogram detects heat or detects inflammation before a mammogram would do that? Is that a safe assessment?
In many cases, for a lot of people, it really depends on where in the spectrum they have their thermogram. And let me just back up too, Nancy. I want to be really clear to say that from my perspective as a practitioner, no test is 100%. There are going to be, there's a potential for false negatives and false positives in every test that's out there, unfortunately. But the sensitivity of thermography combined with another test, most commonly ultrasound, you have a way to increase that sensitivity and specificity to approaching high 90%. And so the risk of a false negative or a false positive is significantly reduced, although again, no test is 100%. So we have the opportunity, yes, if a woman or a young girl enters the thermography testing early on, then yes, we can see changes that would maybe have been normal for multiple years and then change and be now early changes that would indicate something's brewing, I say. But equally, if a woman, if this is her first thermogram and there's already something there, then obviously we enter into the process at a later date. So it can be anything from an actual precancer to an actual cancer, cysts, inflammatory changes, any number of things can be found. Did that answer your question?
Yes, it did. And I'm glad that you mentioned the fact that it is not 100%, that all tests may not be 100%, and there could be false negatives, because I did hear a lot of negativity with some people who said that a thermogram didn't detect something that was going on with them. So, but from what I understand, this is no radiation, and also it's probably less painful. So that would be the next part of my question. What can one expect upon entering into having a thermogram done? What is the process?
It's a very comfortable process, having been someone who's done mammogram for myself as well as thermography. There is no compression, there is no radiation, there is nothing that actually touches the body. A woman sits, and a man, we do these for men as well, but again, talking breast health, a woman sits in a room with a thermographer and a camera. We disrobe the area of the body that we're going to be imaging. In our case, we do full body, upper body, and breast only scans. So in the case of breast tissue, we would disrobe from the waist up, and then images are taken with the camera while the woman sits comfortably on a stool in front of us. So it's a very comfortable setting. Even the lights are dimmed. As a thermographer, I tell all of my patients, I spend 98% of my time looking at the camera and the images on the screen to make sure that those temperature differentials are set appropriately. And so even if a woman is very self-conscious or isn't comfortable being disrobed in front of another person, you're not being looked at, you're not being, no one touches you. It's a very safe, it's a very non-invasive, it's a very easy environment, comfortable environment to be in.
And how long would the process take? How long is the whole process from beginning to end?
That too may vary from office to office. In our office, a breast thermogram for a new patient takes 30 minutes. We spend probably the first 15 to 20 minutes getting a good history, going over all the information, answering any questions she may have. In the instance of a breast scan, which are obviously, I say a breast singular, but it's obviously both breasts, plural. It is, the images are there's only 5 images that are needed. And if she has maybe in many cases found a mass herself or has a concern, we take the 5 standard images and then we can take some additional images where we can actually point to the area of concern. I can adjust the coloring and the different settings on the camera to allow the thermologist additional views and additional information in making that evaluation. In our office and in most cases that I'm aware of, if a thermogram is abnormal, we always follow it up with a breast ultrasound. And those two, again, a breast ultrasound is a great test. It's a very safe test. There's no radiation. It's a very comfortable test. And those 2 tests combined as I mentioned earlier, can bring our sensitivity up to about 98% to know, is the tissue normal or abnormal? Is there something going on that we need to take some further steps toward?
Wow. So then if I'm understanding, if something is detected during the thermogram, other additional views can be done. There could be some adjustments to the camera, what have you, and other images can be performed. In addition to that, if something is still showing a little suspicious, you follow it up with an ultrasound.
Right. Correct.
Okay.
And in our circumstance, if that were abnormal, if there's certainly something pointing to the fact that this woman may be dealing with an early cancer diagnosis or a cancer diagnosis, at that time we would get a mammogram, because she is probably going to be going to see a surgeon or some other, medical provider, to assist her with the next step of the diagnosis. And then typically a mammogram is required.
Very good.
In our office, it is the third thing that we do.
Okay. The other question is, Karen, if someone were looking to have a thermogram done, what would your advice be for the criteria they should be looking for? Are there certain type of cameras? Should they ask for? What are the questions? This is new to many of us, and we don't know if we're going to the right place, and we want to make sure, obviously, that if we're taking this direction, that we're concerned about our health and we're wanting to do the best for our health. So help us to be able to understand the proper questions and criteria we should be looking for.
Most thermographers out there are going to be certified, but I would first and foremost make sure that they do have a certification. It's helpful to ask what type of camera they're using. There are multiple cameras out there, and I'm certainly not going to say that one is better than another. We use a Metatherm camera, which is the camera that's been FDA approved, which is
Karen?
by the doctor that I work with, the preferred form from her perspective. Question from my perspective is, who is going to be, yeah, I'm still here.
Okay, yeah, it's looks like the internet was kind of coming in and out there for a minute. It was telling me the internet connection was low, but I think it got you anyway. So we'll see.
Well, the main thing I was sharing was, the main thing is to find out if my scan is abnormal in any way. What's my next step? Who are they going to refer me to? What doctor or provider will be helping me in this? What are their credentials? In our office, I work with a medical doctor who is a trained thermologist. So she reads all of our images, as well as then knowing what to do if a scan is abnormal. Can I share who I work with?
Oh, yes, offices? Absolutely.
Well, I'm in Charleston, South Carolina. We have the Thermography Center of Charleston, and I work with Dr. Ariane Kamita, we together have Charleston Integrative Medicine, and she also has the Kamita Wellness Center in Baltimore, Maryland. So in our circumstance, Dr. Kamita travels between Baltimore and Charleston, seeing patients. The camera travels with her. She has a thermographer in Baltimore, and I am the thermographer in our office here in Charleston. And so I don't have the camera every day. When she's not here, I'm doing lymphatic therapy, which we can perhaps talk about in a second. But really, as someone evaluates who is going to be doing my images, to me, the most important question is, after my images are done, who's going to be reading them? And if something is abnormal, who is going to help me and ensure that they have the qualifications that you need to know how to follow up on a scan?
Absolutely. Well, thank you for that. I didn't realize the physician you work with travel both locations. So kind of going into now the lymphatic therapy portion of what you do, because that's kind of connected to the thermogram. Is that correct? If you can enlighten us on that.
We certainly connect it with thermography, although it doesn't have to be, and we use it in many circumstances where it's not. But a thermogram is actually the only test, to my knowledge, to visualize and assess the lymphatic system. The lymphatic system covers our whole body. I tell my patients it's like a fishnet stocking, that covers us. And it is a huge component of our immune system. And so when we see lymph congestion on a thermogram, then doing lymphatic therapy and detoxification is an extremely important way to boost the immune system, detoxify the body, and help things return to normal. Equally, if a woman has an abnormal thermogram and we might see breast congestion, which we do see frequently, liver congestion, we can see a lot of drainage from the mouth due to dental issues, thyroid, really, it encompasses the entire body. But the lymphatic therapy is a way to address that and help, again, regain health. In my office, I work with a lot of cancer patients, and we do lymphatic therapy ideally once a week, certainly once every 2 weeks, to help continue to detoxify, cleanse the body as they walk through whatever form of treatment that they're walking through. Some are doing conventional, some are doing totally natural, some are doing a combination. But the lymphatic therapy, again, just helps to cleanse, detoxify. So from my perspective as a lymphatic therapist, anything or anyone that has a chronic diagnosis, whether it's something like cancer, but also any form of infection, any autoimmune disease, up to and including anyone who simply wants to be as healthy as they possibly can be and do just a regular detox, supporting and cleansing and working with the lymphatic system is just an added important way to do that. Absolutely. There are some doctors who particularly are working with cancer from a natural perspective, believe that it will be very hard for someone to overcome their diagnosis without addressing the lymphatic system.
Absolutely. Karen, now you've mentioned the word breast congestion. What exactly does that mean? Since we're talking about breast health, you've mentioned liver congestion as well. When you say when a breast is congested, what does that mean?
It's like, I use this simple analogy. It's kind of like a clogged sink. It's looking at your lymphatic system, and we can see that your system is not draining well. It should be constantly moving like a slow flowing river, moving along, throughout the day. And particularly women who have breast implants, very chronic. You've got, I'm going to say almost a form of obstruction there that inhibits some of the natural flow. Women who are very stationary, who maybe sit at a desk all day and don't get a lot of exercise. People who are carrying some excess weight, large-breasted women, anything that there's more tissue there, if you will, can obstruct the normal lymphatic flow. I'm going to throw a curveball in here and say I'm also a mineral practitioner and do nutritional consults looking specifically at rebalancing the minerals. And we know equally that when those are out of balance, specifically lacking bioavailable copper, that can slow down the flow of our lymphatic system. So there are many aspects and avenues that we can walk down to help a lady or a gentleman regain their health and make sure everything is functioning as optimally as we can. But the congestion is just a slow moving, or like a little bit of a clogged sink. We're not getting good drainage in the tissue.
That's interesting. I just learned a lot just with that brief part that you said right there. I do appreciate that. I know that you mentioned you're a mineral specialist.
Well, I'm a nutritional consultant.
Okay.
Consultant, but I've done some added training in minerals, specifically working as a root cause protocol mineral consultant. So yeah, working to help people regain mineral balance. I tell everyone if you were going to build a house, you would want your foundation of your home to be as strong as possible. As we build this house every day with ourselves, our mineral status is, I view, as the foundation of the health of our physical structure. You mentioned earlier spirit, soul, and body. All three absolutely have to be healthy. Personally, I call the body low man on the totem pole. From my perspective, first the spirit, then the soul, then the body. But as we help the body to be healthy, We absolutely need to have proper mineralization. And unfortunately in our world today, because of the overfarming, because the nutrients are not put back into the soils, because of the pesticides that are sprayed on the bulk of our crops, even when we're doing 100% organic, because of air and rainfall, there's still some contamination. All of these pesticides actually chelate minerals out of our soil. And so even when we're eating as clean and as pure as we possibly know how to, there's still severe mineral depletion from our diet today. And certainly for the person who is consuming primarily a processed food or processed diet, severe depletion. And so I test people of all ages, and I tell everyone up front, no one has a perfect score, so don't be alarmed. You're going to have deficiencies. We just need to know what they are to know what to address in each individual person, because certainly, for the most part, one size does not fit all. There are a few exceptions that all of us can benefit from, but in many cases, we need to do a little individualization as well.
Absolutely. Thank you for that. Now, Karen, tell us how you got to this journey. How did you develop such an awareness and passion for this topic, and where your journey that brought you to where you are today? And in fact, you mentioned that you're currently now in school. So if you can give us a little information about who you are and what's your journey in terms of where you are now.
Thank you. I actually consider myself just a perpetual learner. I tell everyone the more I learn I don't know. It's an endless supply of information, and I truly have a quest to help everyone that I have the honor and privilege to be a part of their life, to help them be as healthy as they can be. And that requires just continually obtaining more tools and more awareness and more knowledge. So, gosh, it's kind of a long story, but I'll be as quick as I can. I'm actually a physician assistant and practiced a very traditional medicine in a very traditional office for about 15 years. In the late 1990s, honestly, I started getting sick myself and realized that if I were going to get well, I had to step off the path of what I knew of conventional medicine. And that began a search for me personally. And then the more I learned over the course of, 4 or 5 years, the more I learned that I couldn't not share that information. And I got to the point that I no longer felt that I was doing the best that I could do for people by remaining in that conventional office. It has a role and it has a place. I mean, no disrespect as I say that, but for me, I had to step outside of those boundaries. The most important thing was the more I learned, again, the more I wanted to learn. It was like a whole new world that had opened to me. And I was already doing thermography for myself, and then just have been on a walk ever since, trying to learn as much as I can. When I had the opportunity to work with Dr. Kamita, it was just a way, again, to learn another skill, to have new knowledge, to work firsthand with a holistic medical doctor, to just continue on my path. And I've just continued to add to that with the lymphatic therapy, with the nutrition counseling. I've actually been working on my Doctor of Naturopath. I've put a comma in that right now because cancer, as we know, is exploding in our world. And personally, someone extremely dear to me had a cancer diagnosis. And it led me to recognize that I didn't know enough in that area. And so I'm actually now in the process of becoming a certified professional cancer coach. And just, again, it's just a quest to help people be as healthy as they can be. Some people are ready for the information. Some people aren't. Some people are ready to do whatever they have to do to regain their health. Some people don't want to change a thing. I'm just honored to be able to be hopefully a resource to those who are looking for change and are ready for change and looking for, and it doesn't even have to be a completely alternative way. They can combine it very much in what they're doing in their natural or in their, whatever makes them comfortable from their health perspective, but offering as many possibilities and avenues and options. That's really, I think I said this earlier, but that's really for me, is that people need to know that there are options. They need to know that there is so much available and so much out there, and people who are honestly passionate to help them regain their health. And most of us who are on this path have been impacted and have been led, on this new path in trying to both regain our own health or someone that we love. And it's an honor and it's a privilege. And I just continue to try to learn more to apply it not only to my own life, but to those that I work with.
Karen, thank you for that. And you said it, you know, the purpose of me doing this is to bring an awareness, to let everyone know that there are options. And that has been my passion and my desire, to let everybody know that there are options, and to be aware that there are options, and to be able to be informed, to be able to choose the best option for you. In nowhere, shape, form, or fashion are we saying thermogram. We're telling people go out and get a thermogram and never have a mammogram. That is still everybody's individual option or choice. But the key is to know that there is another possibility out there. There might be somebody out there who's concerned about the radiation. There might be somebody out there who's experienced mammograms and know how painful they very much can be. And it's like, oh no, never again. But yet we want to be able to be as healthy as we possibly can be as well, and be able to make sure our breasts are healthy. So one more thing, Karen, is, does insurance cover thermograms? And then my system is telling me the internet connection is low again. I know this is still recording. Hopefully we can get Karen back. You there, Karen? Let's see if I need to do anything here.
I think I'm still here, but
You are. I gotcha.
There you go. You're back now. Good. Okay, good. One thing that I would like to share real quick, Nancy, and yes, women do need to know they have a choice, but there are some women who are not great mammogram candidates, frankly. A woman who has these referties, her tissue is so dense, hard to visualize anything in that tissue. A woman with implants, a woman who has large breast, equal surgery, maybe reduction or prior biopsy where there could be some scar tissue. These are all women who aren't great mammography candidates, but are perfect for thermography. And I do also want to say that the most recent mammogram recommendations from the Annals of Internal Medicine, February 2016, I believe it is, they recommend biannual or every 2 years mammography for women between 50 and 75. They don't even recommend really starting mammography before the age of 50. And then every 2 years. So every woman who is starting early, every woman who is getting an annual scan, in my opinion, is exposing herself to unnecessary radiation, and needs to be just aware and just needs to be aware. And so I'm by no means saying don't do a mammogram, but I am saying there are people that need to reconsider, ages that need to be considered, breast health overall that needs to be considered, and be aware that thermography in many cases is a better choice. So that they don't have to have an unnecessary biopsy. They don't have to have the scare of being called back for additional views. Even today, you know, they talk a lot about the 3D mammography, which exposes a woman to 2 to 3 times more radiation. Unfortunately, in many cases, thermography is not paid for by insurance. So some people do make the choice of mammography because it's what their insurance will cover. But it really can be affordable and, in my opinion, just better for our health long term. And then maybe consider, if you're going to do mammography, every couple years rather than annually, and certainly within the parameters of the age that are currently recommended.
Absolutely. Thank you for that, Karen. Now, like I said, I think you and I have the same heart and just wanting everybody to be aware of the choices. Well, at this time, this does conclude our time together. I so appreciate you. Karen, for coming today and being a part of sharing my passion. You and I have the same desire of bringing awareness and help to those who are sick and who just are looking for other options. That is definitely my heart's desire. I too had somebody very dear to me pass away from cancer diagnosis, actually 2 members of my family. So I do have a quest and a heart to let people know that there are options. So Karen, again, thank you. So appreciate our time together. This does conclude our time together, unless, Karen, there's anything else on your heart that you want to convey to our audience. And if you want to say the name of where you are, in case there's anybody out in those areas that would like to avail themselves to your services.
Oh, thank you very much. I will just say we're going to be adding some new videos to our websites. They're not up yet, unfortunately. We have actually 2 websites here locally, charlestonintegrativemedicine.com, and then also Dr. Kamita's Baltimore site is kamitawellness.com. And there's certainly information on thermography, information on our other services, how to contact me if that should be desired, or Dr. Kamita if you'd like an appointment with her. And I will just say, please visit the website in the future, because there are going to be some very specific and some very good videos added dealing with thermography and just the subjects that we've covered today. So thank you, Nancy, for the opportunity.
Absolutely. And what I'll do is on the YouTube channel, I'll just put those links to those websites so people can look that all up. But people, do your research. Do your research, be aware, make an informed decision, stay healthy, and we'll see you at our next video. Have a good day, everybody.
Thank you.